In bioethics, autonomy is one of the foundational moral principles guiding ethical decision-making in healthcare. Alongside beneficence, non-maleficence, and justice, autonomy shapes how clinicians, institutions, and societies understand the moral status of patients. At its core, autonomy reflects a commitment to respect for persons, the idea that individuals are moral agents with the right to make meaningful decisions about their own lives and bodies. This principle did not emerge in isolation. It developed in response to historical abuses in medicine and research, where patients were often treated as passive subjects rather than active participants. Modern healthcare ethics places autonomy at the center to prevent coercion, exploitation, and paternalism. What is autonomy? Autonomy refers to an individual's capacity and right to make informed, voluntary decisions about their own care, free from undue external control. To say that a patient is autonomous does not mean that their choices must be medically optimal, rational by professional standards, or aligned with clinician recommendations. Rather, autonomy affirms that competent individuals have the moral authority to decide for themselves, even when others disagree with those decisions. In healthcare ethics, autonomy is not merely a philosophical ideal. It is a practical obligation that governs consent, refusal of treatment, confidentiality, and patient participation in care planning. Core elements of autonomy. For a decision to be considered autonomous, 4 core elements must be present. 1. Capacity or competence. The individual must have the ability to understand relevant information, appreciate the consequences of their decision, reason about options, and communicate a choice. Capacity is task-specific and situational, not global or permanent. 2. Information patients must be given sufficient, truthful, and understandable information about their condition, proposed interventions, risks and benefits, reasonable alternatives, likely outcomes of refusal. Without adequate information, choice becomes illusory rather than autonomous. 3. Voluntariness. The decision must be made freely, without coercion, manipulation, or undue pressure. This includes subtle forms of influence such as family coercion, institutional pressure, or economic vulnerability. 4. Intentional choice. The decision must be deliberate and reflective, not accidental, impulsive, or the result of confusion. Autonomy as respect for persons. Autonomy is grounded in the ethical conviction that persons possess intrinsic dignity and moral worth. Respecting autonomy means treating patients not as means to an end, whether institutional efficiency, public health goals, or professional ideals, but as ends in themselves. This respect requires clinicians to listen carefully to patient values, take refusals seriously, avoid overriding patient wishes without strong ethical justification, recognize patients as partners rather than passive recipients of care. Autonomy in clinical practice. In practical terms, autonomy is most visibly expressed through informed consent, informed refusal, advance directives, shared decision-making. Importantly, autonomy does not require patients to make decisions alone. Accepting guidance, deferring to expertise, or involving family members can still be fully autonomous, as long as the patient chooses to do so freely. What autonomy is not, it is critical to clarify what autonomy does not mean. It does not mean patients can demand any treatment they want. It does not eliminate professional judgment. It does not override concerns for safety, justice, or harm to others. It is not absolute. Autonomy exists within ethical, legal, and relational boundaries. Conclusion. The principle of autonomy establishes a moral baseline for ethical healthcare. Patients are agents, not objects. Understanding autonomy as informed, voluntary, and intentional choice allows clinicians to honor patient dignity while navigating the complex realities of medical care. As we move forward, this definition of autonomy will serve as a reference point when we examine its limits, its tension with beneficence and non-maleficence, and its role within broader systems of justice.